Good afternoon, everyone, and thank you for attending our very special webinar today with a panel of 5 experts who are going to speak with you today about surviving a pandemic, lessons learned, and future state. As we all know, the pandemic has changed the way that all of us do things and have done things over the last year or so. And through this webinar, we're going to examine some of those changes and focus on a special story about a contractor. So thank you very much for attending, and thank you to our panel. We really appreciate you being here. I'd like to encourage everyone in the audience to submit questions throughout the webinar. At the end, we will have a Q&A session of about 10 to 15 minutes where our expert panel will address your questions. And please know that if you have additional questions that you think of maybe after the webinar, you can reach out to me directly and I will be sure to pass your questions on to get answered by the experts that we have with us today. And just to introduce them briefly, Dan James serves as Senior Account Executive at STC Safety and is a professor at Southeastern Oklahoma State University and an adjunct professor at Oklahoma State University. Daniel leverages his 20-year industry experience and passion for helping people to assist commercial construction and manufacturing clientele in achieving cultural excellence through the creation and implementation of sustainable safety and risk programs. Nathan Nichols brings over 18 years of knowledge of the electrical industry to Amber Electrical as the COO. As a journeyman electrician himself, he is able to provide electricians with guidance to prepare them for a future at Amber Electric. Jeff Wolfla serves as VP, Insurance and Safety Services for Boyd, Shackelford, Barnett, and Dixon, LLC. He's responsible for providing clients with property and casualty insurance while offering the value add of safety consulting to those he serves. Dan Sadler serves as VP of Safety for Structure Tone Southwest. He has customized project safety programs to fit well-known clients such as State Farm, Cyrus One, ConocoPhillips, Phillips 66, Shell, Valero, and others. And Herb Santos is a certified industrial hygienist and certified safety professional with 13 plus years of experience. Currently, he is the Director of Safety for Osborne Contractors conducting business throughout Texas. So with that said, I'd like to once again welcome our panel and take it away.
Awesome. Thank you, Lori, very much. This is Jeff Wolfla. I'd like to discuss a little bit about what we're going to cover today. We're really excited about providing you guys some information, some stories, and some takeaways of this pandemic and things that we can do to build on the future. So one of the things that we're going to cover is the Amber Electric's pandemic story. We got a story that is going to tell about what the impact of the pandemic had on one of our fellow contractors in the industry and how they came through with that, and some lessons learned and some takeaways. And then also we're going to cover the impacts on health and safety. These are derived from the questions that we sent out to the attendees and to the industry to get feedback as to some of the information that would help you in the future. So one of those was the impacts. Another is great work practices. We're going to discuss some examples of those. And we're also going to share some resources for the future in the event that something like this happens again. We'll hopefully be able to provide you some information to take away and use in the future. And then finally, we'll end with a Q&A session. So look forward to presenting. Now I'd like to introduce Nathan Nichols. Nathan is the Executive Vice President of Amber Electric. As mentioned, he brings 18 years of knowledge to the industry, to his employees. And I think he's got a really cool story to tell and some interesting facts about, the impact that the pandemic had on him specifically and how he overcame that. So without further ado, Nathan.
Thank you, Jeff. It's good to be with you guys today, and thank y'all for having me. Just a little history of Amber Electrical. Came over about 3 years ago this June, and it was rocking and rolling, and we were getting going, and then bam, a pandemic hits and kind of slows, kind of screeches to a grinding halt. So I can, thinking back on that day, we kept hearing about the pandemic and wondering what is this pandemic? What's going to happen? What is there really any effect it's going to have on our business? And we just keep thinking that people are overreacting. It's going to be fine. We'll move past it just like we do and have historically. And I was walking down the hall in our office, and I get an alert on my phone telling me the NBA season has been canceled, and that's when it hit close to home. And thinking, oh my goodness, this is something different. This is something we've never experienced in our lifetime. So as a leader in our company, our immediate reaction and thought process went to our employees, and how we have to take care of those folks, and how we have to take care of their families, and the issues and concerns of health and safety, and what the priorities were. And then when, in those discussions, we start talking about our customers. How in the heck are we going to take care of those folks and get them through this? And what are we going to do to make sure this is being done at a high level and done more important than anything at that point, with the safety and health of everybody involved. So as everybody experienced, everybody kind of went into scramble mode, and we really developed a plan to kind of attack that and hit it head on. And although there for a while we didn't get affected by it personally or at the company, we had our first case, and man, it was wow. That really just is one of those things. If y'all remember, it was oh, this can't happen to me. We're not going to know anybody. You hear about it up in the Northeast and in these different states and areas, and oh, this isn't going to hit me, and then bam, it does. And at a large manufacturing facility for a really high level customer that we take care of, and we hit that head on. We were honest, we were open with what we had to do and what was going on, and really following the step and everything that we knew, which was changing every day, it seemed like, or every hour there for a while, to find out what the steps were and how we were going to handle this, and making sure that employee was taken care of, his family was safe, he was safe, the employees working around him, the customers. And as we continue to plan for the future, didn't feel really immediate impacts. It wasn't until, as far as the industry was concerned, we took it was kind of a week there to catch your breath, but everybody was willing to work and stay working and doing what they could, whether it was face masks, and it was face shields, and it was gloves, and it was all these different steps we had to take that changed, like I said, sometimes on the hour, to get us through and make sure we were keeping everybody in safe and healthy. And then as we continued to grow forward and grow stronger as a company, we decided we were going to do that, and we were going to come out stronger on the backside of this. And that's when, as you all know, our industry tends to lag the market. Then we start running into the manpower issues. We can't find enough people to work, to get out there that want to work. We start running into material and supply chain issues. Everything seems to be on back order in delays that we've never experienced, up and down the supply chain, up and down the manpower concerns and issues that we are. And as a matter of fact, we're still experiencing them today. All of the supply chains, it seems like every time you turn around, something's on back order, whether it's a bandsaw, whether it's couplings. I've never heard of a coupling shortage for as long as I've been in the industry, and that's where we're at today. So those things are still affecting our business and how we plan and how we are trying to strategically put together a plan to attack the future and come out stronger. One of the recent items that we did was, which was a blanket order of material, a large, vast majority of material. And that's going to be something on the proactive side, on the offensive side, that we feel is going to allow us to get to another level. We took a little different look at our structure and our business and how we were going to grow and how we were going to be stronger internally so we can show that strength to our customers and to our employees. So we at Amber are poised to have hopefully one of the biggest years coming out of this pandemic. We have a clear vision and a plan for the future. We continue to attack it every day with every challenge that presents itself. And I'm excited about what the future has to hold. I'm glad and happy and thankful to be here today. And hopefully in the near future, our paths will cross. And if there's anything that you have questions on here and after the show or after the slideshow, then I'll be willing to answer them. So thank you guys again, and I appreciate you having me.
Thanks, Nathan.
Yeah, thank you, Nathan, very much. Well, that's a little story of the Amber and how the Amber story on how the pandemic affected them. And I'd like to go into some other impacts that the construction industry has. So, Damien, would you like to?
Yeah, but Jeff, if I may, before we move on with Nathan, I heard an interesting fact, Nathan, so I'm going to ask you this directly. Other contractors have actually seen faster projects now after the pandemic because they feel like they're better planned. They stage their jobs better. Their hierarchy of installations on point. Would you agree with that?
Absolutely. It really allowed us to take a step back and look at that and really plan and structure to have those, be able to have those discussions and those steps in place to be more successful and provide a safer, healthier, quicker install.
Cool. Yeah, and I thought the other interesting outcome of COVID's all been bad, right? Well, the positive outcomes that came out of it was that, number one, looking at your look aheads, but number two, I think, was the fact that people are a little more versatile, right? And so we've got people who never use a computer now having Zoom meetings or WebEx meetings, and so in some way we're more productive because we're able to be more connected, right?
Yeah, it simply keeps you off the road. You're able to sit at your desk and have a meeting with the people you need to have a meeting with, and you get more done. You get more time back in the day.
So I'm sorry, I just thought I'd ask it when I was thinking about it. Yeah, it was great. So some other impacts that obviously Nathan and Amber Electric had experienced, but others. So the 40% of construction companies experience delays or stops in work either due to financing or material shortage, right? Which leads to number two, 22% experience supplier delivery delays. So not just the manufacturing of the product or just the overseas manufacture, but also distribution and delivery of those being delayed through ports and things along those lines. 10% experience absenteeism of the workforce. Actually, this is low for the United States because we're in construction, and we know a lot of our employees that we value very much, as a lot of us are people-centered companies. If they don't show up to work, then they don't eat, and if they don't eat, that's a problem, right? So they're more likely to show up to work, and almost to the opposite of the effect where they may be causing more danger because they want to come to work, they may not be feeling well, right? So 10% on absenteeism, 50% experience slowed production due to things like wearing masks, staggered start times, and things along those lines. Increased percentage of workers' comp claims, so COVID-related, some of the programs put in place around COVID, and then 74% of firms are seeking the payment protection loans as well. So all that's a construction impact piece.
Awesome, thank you. So here's one of the questions from the survey. We're going to have 3 different questions that we pulled from the survey, and this is one of them. Prioritize the items below to express how COVID has impacted your business. And the answer is employee health and safety concerns was the #1 concern as far as the impact that COVID had. So let's dive into some health and safety concerns. Herb, would you like to discuss health and safety impacts?
Yeah, thanks, Jeff. So obviously with the pandemic, some of the potential outcomes are pretty obvious, such as infection outbreak and effects on personnel health. Some of the maybe unforeseen effects include workers' distractions, such as challenge communicating while wearing a face mask or a gaiter, an increase in injury claims. So again, COVID is a OSHA reportable injury, and so we're starting to see some information which is credible and some that is rather questionable. Some of the PPE supply that everyone throughout every industry noted, especially in healthcare, the 3M N95s in general, are still at a shortage. One of the probably unforeseen or largest unforeseen hazard is the cybersecurity to your organization. Now with everyone working remotely, or with a significant portion of the population working remotely, it's a bit easier for personnel and those that are trying to take advantage of these weaknesses in our personal computers and settings to tap into your resources at work. Managing and implementing practices, again, have been impacted. Absenteeism, again, as noted before, it's 10%. That's still to be seen what the final outcome on that is. I believe that's rather low based on our industry and the type of work that we do. So it'll be interesting to see when the mega data analysis comes out. Administrative burdens, now we have to add COVID-related information to new hires, to onboarding, to project-specific orientations. We've also got to do a little bit of contact tracing if a case does come up at one of our job sites. So again, a burden on the administrative portion. Logistics, one of the things that had not been really evaluated is how does this impact carpooling when you're traveling out of town for work? Is your organization allowing personnel to bunk in more than one single room? So we're seeing some potential for impact on that. As far as the increased OSHA requirements, we'll jump into the next slide and we'll look at how OSHA is adding the COVID response into their national emphasis program. Next slide, please. So as you see in the slide, March 12th, 2021, the national emphasis program becomes effective. So what does that mean for a business? Really what that means, like any national emphasis program, is that OSHA will be adding additional resources, funding, additional overall compensation for COVID as it relates to business. So as you see the progression, state plans will inform OSHA of their intent by May 12, 2021. So yet to see how each individual state will respond to the federal mandate. And if by May 12, 2021, a state has not adopted a state-specific national emphasis program, then they will have to be mandated to adhere to the federal requirements. So it'll be an interesting transition to see how this national emphasis program really does add additional resources that employers such as yourselves and us can provide to our employees and lean on our federal government for some assistance. Next slide, please.
Hey, so appreciate that, Herb. That's really good insight. I really like the part about the national emphasis program. That's probably new to a lot of people. So thank you for sharing that. Dan Sadler and myself are going to kind of tackle this. And Dan, I'll let you go over the matrix and the resources and contact tracing later on. But the best practices with, that we've seen that have been working, right, is the CDC is a guidance, right? It's not a rule, it's not a policy, it's not a requirement, it's guidance on how to tackle suspected and confirmed cases, along with that bullet point 2, that decision matrix on determining reporting requirements, both internally. So you think about a big general construction job site, right? You got your customer, if you're the GC or you're the subcontractor, right? You want to report it up to your general contractor. They want to report it up to the building owner, owner's rep. But at the same time, you're reporting to your team, both at the office and in the field, about what's going on. So mass communication is going on there in the reporting piece. Dan, I'll let you close out those last 3 bullet points.
Yeah, so thanks, Daniel. So the biggest thing for us as a general contractor on site, doing work in a variety of cities, that a lot of y'all work in those cities, you'll notice that there's a lot of reporting, both internal for the building and property manager, up through the end user and the client. So we had to come up with some useful tools that we'll share with you later in the presentation. But the one takeaway I would say is, as something for you to think about as you're doing your pandemic preparedness planning, is really think about how you communicate out to your employees. For us, it's our trade partners working with us on the jobs to help build the projects and the employees that are working there. It's also reporting to the building and property manager, and also to the end user. We may be working in a pharmaceutical area or an unoccupied space in a building, an Amazon, call center. And so there's a lot of people that could be affected by those. So we have to make sure that we're reporting properly. So we've created some templates to send out, and part of that decision matrix and templates that go out for communication is trying to isolate folks affected by those that have become sick or infected with COVID in this case. But you all know as well as I do, I'm probably not telling you all anything new, but you know how quickly these things change. It went from 7 days, it went from 14 days to 10 days not affected to 7 days with a test. So we're really using CDC as a guidance and trying to isolate folks. And we kind of took a conservative stance as a contractor to say, hey, we're identifying suspected and confirmed cases all the same. They have to return with a doctor's note to come back to the job site if they're affected. And if they tested and come back, we want to make sure we have a licensed healthcare provider or licensed healthcare practitioner provide us with some information to clear that employee to come back to work. And so we utilize that as a best practice. And I never worked as closely with HR and our senior operations team in all of my career as I have this past year. We kept matrices on subcontractors' kids that were affected by it, all the way to the people that are putting the work in place, to coworkers, or even employees that are on site that have come into contact with them. We tried to isolate and just use a conservative approach. So just make sure that you kind of take a look at that internally and as Daniel said, come up with some guidance to help you make some good decisions.
Awesome. Thank you, Dan and Daniel, for that. One of the other questions that we sent out was, what type of information and or support do you need the most right now? And the answer from the feedback was industry best work practices related to COVID. So we're going to jump in. Dan Sadler, would you like to kind of run through what we've put together as far as our safe work practices?
Sure, and I think Daniel and also Herb could chime in as well, but I'll touch on a few things, and we've got some slides, some photos that kind of show you some best practices. I'm sure that a lot of y'all have used some of these, but the one thing to note kind of moving forward for us at Structure Tone was, hey, look, we do have things like distancing and hand washing basins at the job site, but we really looked at things that affected, high traffic touch spaces like freight elevators and choke points coming into the job site, communal eating areas, where we're really congregating. And so the takeaway for us moving forward, even past the pandemic, looking forward, is we're still going to utilize some of these hygiene practices. We're still going to implement hand washing stations. Instead of 1 per 40 on the porta johns, we're doing 1 per 10 and making sure they're cleaned several times a week. Those are just things that we should have been doing all along, but throughout this kind of looking through, we felt are important enough to move forward. But really looking at some of the safe work practices, and depending on the state that you're in and your local leadership, as you all know, that some folks are still trying to open up and others are open. So, putting some safe work practices in place, and really keeping in mind that, for us, we work for a variety of clients, and we got to be really sensitive to what their requirements are as well, not only from a reporting standpoint, but they may have additional requirements for distancing, check-in, questions to be asked to enter their building, temp checks, things like that. So I know Daniel's got great stories to share along the food truck story. Daniel, you might want to share that with them.
Be read my mind. So nothing I like more than 9 a.m. at break time, the food truck pulls up and honks its horn, right? But we managed over 50 different cases, and over half of those led back to break time, lunchtime, i.e. food truck coming on site. So we found that a lot of the contractors were doing a great job while their tools were on of wearing their face masks, wiping down their tools, cleaning their hands, keeping their distance, working with the same partner and the same scissor lift the whole time. That was going great. But it was like we just turned off the switch and then we went on break and we were just commingling. We're sharing food. Here, have a bite of my burrito. It was insane, right? And so we're handling money at the food truck. So something as simple as that, I believe, caused over 25 different outbreaks where we had to treat as a suspected or confirmed case for different clients. And so I just caution you guys, don't let your guard down. So I'm pretty passionate about that one because that was usually our root cause of a lot of events that came on. And the other ones were really related to probably somebody's kid, their grandma, or some kind of social gathering, right? But I'll turn it over to Herb now to touch on the rest of these real quick.
Yeah, thank you, gents. I mean, some of the unforeseen effects, as you noticed, was, some of the GCs not allowing carpooling. Not so big of a problem anywhere else, but again, when you're traveling into inner cities, Dallas metro area, Austin metro area, can be a big challenge. Some of our employees do not own vehicles. So how do we safely get them in and out of a job and still satisfy a GC's requirements? Another thing is document handling. As most of you have seen, a lot of the document transferring signatures have all gone digital. I would say in the past, I've rarely used a digital PDF or similar copy of a document to get something to the appropriate hands, but now going forward, it seems like that's a majority of what's being asked of our personnel. So again, some of these best work practices are not only to be used during the pandemic, but I truly feel that this is going to be a fundamental change in the way we do business going forward. So again, as noted, some of the things like food trucks, chow halls, where we congregate, and document management and transferring will, I think, forever be changed. Yet to see what the final result is, but I think we can already start establishing some best practices.
Awesome. Well, thank you, Herb. Thank you, Dan and Daniel, for sharing some of those best work practices. Let's go into some further detail on practical solutions. This is more the nuts and bolts as to how you can put a plan together. So one of the things that you want to do is put a plan, like we discussed, and we're going to elaborate more on each one of these. You want to have an educational program, a communications program, preventative measures implemented, social distancing and people movement plan, site cleaning protocol, and fit for duty standards. So going into the planning, Herb, would you like to kind of run through what we have here for the planning?
Yeah, thank you, Jeff. So one of the key strategies for addressing a pandemic has always been planning. Thinking ahead about what a project looks like from the logistics point of view on how you access or leave a project, egress, foot traffic, areas of congregation. Again, something that may be overlooked is where do people eat? How do they gather together? Can help identify risk mitigation strategies for both the office setting and a site or a construction site setting. Additionally, by creating a company pandemic preparedness plan, you can identify appropriate risk mitigation strategies for every scenario within your book of business. Some of the key work practices that are still in existence and still being recommended by agencies like the CDC, OSHA, and others are social distancing, looking at your logistics, maybe from an administrative point of view, staggering work shifts, maybe additional headcount to make sure that personnel are not working past their hours and bumping into other work shifts. Hygiene practices such as surface cleaning, tool cleaning, PPE requirements. I know for my organization, we're hyper aware of making sure that our PPE inventory is not only suitable for the next month, but 6 months from now, could we hold over till then should another PPE shortage happen? Meeting requirements. Is it absolutely necessary to meet in person or could we do this remotely? And again, cleaning requirements to the effect that some companies, including ours, have hired full-time environmental hygiene personnel to make sure that our surfaces, our vehicles, and other work areas are not being negatively affected. So moving on to the next slide, you will see the pandemic preparedness plan linked by OSHA. I know the font is a little small. We just wanted to take a screenshot about what the resources offer, but I highly recommend that you take a look through this fantastic resource. it does provide not only some of the OSHA requirements, but it does also include some of the best practices amongst organizations, FEMA, CDC, World Health Organization. So again, this one-stop shop can provide a great overview of how to establish a fantastic preparedness plan. And the next slide will provide some insight on a commonly used tool considered the risk matrix. For those of us who are EHS professionals, this is no different than what we would use throughout our routine practice. So what a risk matrix does is it evaluates the probability of an event occurring versus the potential severity of impact or consequences. So it's a powerful proactive tool because a pandemic or a situation does not have to occur for you to plan accordingly. It's basically a what if game. You present a scenario and then you look at what all the potential consequences are. This is a simplified risk matrix. This is a 2x2, but they do increase all the way up to a 8x8, a 16x16. When you see those larger risk matrix, really what you're looking at is a more honed in scope of detail. So here, as you can see in this slide, you see a very large overview such as low impact, low risk, minimal to no notes, high risk, which is the upper right-hand corner. You'll start looking at supply chain disruptions, business interruptions, personnel interruptions, but it's still giving you that bird's eye view where the 8x8, 16x16 is giving you minutia nuance in a key focus on looking at your risk. So again, powerful tool. If any of you have any questions, your local EHS professional or experts can provide some assistance with that.
Awesome. Dan, would you like to touch base on the educational piece?
Yeah, I'll kind of move through these next two slides fairly quick. So the educational piece, the one thing we call them gentle reminders, Jeff, just moving around the job site, reminding people of things like distancing, reminding people that hand washing is outside of the porta-johns and we've got hand wash stations, and trying to ingrain in them just some basic hygiene, right? Wash before you eat, wash frequently as you come in the job, that sort of thing. And then project orientation, JHA and PTPs is another thing that we really tried to focus a lot of energy on. Not only were we just auditing for compliance and making sure that best practices are being adhered to, is we wanted to find out through our JHA and our video planning huddles that we utilize, is to try to make sure they're addressing things like PPE requirements and things like distancing. If we're working in a congested space and we've got multiple trades in there, are they talking about things like distancing? So that was something that we tried to discuss as well. On the next slide, on the communication piece, what we tried to do is we had a lot of upfront communication that went out. And I know y'all talked a lot about this, but just getting that basic knowledge is, hey, stay home if you're sick. So we don't have any more heroes anymore. People coming to work with colds and sinuses and maybe running a temperature, trying to ingrain and retrain these folks of our industry that's been pretty tough on that is hey, stay home if you're sick. And then that compiles to another issue. And as Daniel James and I were discussing this prior to this is, do they get paid? And how does a company handle that issue and try to help encourage them to stay home? So reporting requirements to the GC and the building owner, and then also communicating the trade partner or the employee that was affected by it is not letting them back until we get a clear from a doctor is a best practice we utilize. Reminding the chair age daily and kind of inspecting what we expect is something that our president of the company, and I'm sure Jared does the same thing when he goes out, is paying attention to things like distancing and, sometimes schedule has to be affected by, we do a lot of turnout on large commercial interiors projects, and we're doing some stuff over in Fort Worth, and we had several times where we had multiple tradesmen, electricians affected by outbreaks. And so, are we doing things like, are we going up one stairwell and coming down the next? And are we inspecting check-in points and medic stations as they come in to do temp checks? So those are things that we're trying to communicate with them constantly in our stand downs. And then as we move forward on the next slide, talking a little bit about preventative measures. I know Herb's got some things to say about this, but the one thing that I would say on the preventative measures question is, What are we doing? Do we have people like COVID captains or champions on our job sites that are in charge of things like questionnaire and temp checks? And I know, Herb, you have some things to say about this, but assigning tasks to people that haven't been assigned these types of things, looking for things like distancing, mask wearing, utilizing hand washing and things like that, trying to be a little bit more preventative or cautionary. So Herb, I don't know if you have anything to add on this preventative measures piece.
Yeah, thanks, Dan. I think you highlighted exactly what one of the best practices is, and that's establishing a COVID, whether you call them a coordinator, officer, team lead, whatever that may be. In some of the best practices, we've actually established a COVID officer for every single job site. In some settings, that's not necessary, and it's based on the department or a team that's out in the field. So like you noted, some of the best practices is having the COVID officer collect the medical questionnaire. A lot of great resources on the CDC, World Health Organization, and OSHA website. Finding out whether that person has been at risk of exposure, finding out if they're displaying any symptoms of COVID. Additionally, that person can collect temperature-related information, the employee names, who they work for, what department. So that'll allow easier access to complete the contact tracing should something happen. With that as well, this person acts as a stopgap for every single project. During a pandemic, one of the key things that a company can do is limit access to a project or to a project area only to those that only need to be there. In general, we're kind of an open environment for a lot of vendors, contractors, subcontractors, you name it, visitors. But during these times, we really have locked that down to just the absolutely necessary, I hate to use the word essential personnel. So that may be something to look into your organization and find out who is absolutely necessary to be on the job site at any given time. And how can you further reduce that? Could you reduce the amount of foot traffic and personnel on a project? So I think, as you noted, this is one of the most essential and most cost-worthy investments for a company to do, is to find out and establish who can be a COVID officer and how they can help your organization.
Thanks,
Moving
sir.
on to the next slide.
Yeah, great point.
No, I think we've covered all this high touch point areas, out of town work, the food truck, the document exchange, and the lunch areas. I'll take a different spin on this real quick for 20 seconds. Also look at the increased risk of your people population, right? So the CDC has guidance on high risk individuals with certain underlying health conditions and certain ages. So, if you have an aging workforce or some with underlying health conditions, consider that as well in your risk plan. And also the customer you're working for and location, i.e. hospitals and things like that, as we always do with ICRA and things along those lines, keep all that in consideration. So it's multi-pronged and multi-layered. Project logistics.
I think we covered basically all of this,
Yeah, I mean, I think what we're talking about here is the egress and ingress foot traffic, right? We're trying to keep people one way in, one way out, so they can be temperature scanned. At the same time, we're causing a problem because people are congregating on the way in or out. So that's one consideration. Another one was a lot of our normal business operations like daily JHA huddles, stand downs. Those aren't as prominent now because of COVID. So we've got to find new, unique ways to manage that on a job site. I think Dan has the company and Project Hygiene Protocol and a lot of good pictures after this. So take it away, Dan.
Yeah, I'll fly through these. I know folks are looking at their watch going, where are we at? So we've got some hygiene protocol. One of the things that we looked at, and I know y'all may live and work in different areas of the country and getting affected differently by local decision makers. And one of the things we looked at was kind of a playbook opening up. What are we going to do logistically, both for our offices to keep our people safe, and then what we're going to do logistically on our job sites? And so here in Texas, things are getting cut back a little bit. We're opening up. We're seeing some number trends go down. And so we still have a lot of these practices in place on a lot of our jobs. So I'm just going to highlight a few of these, looking at congregation areas and things like hand washing. So let's hit the next slide. So as we're moving through here, these are just some best practices, and y'all have seen these, trying to find check-in points. We used a lot of medics. We initially did some temp checking of our own with face shields and PPE and things like that. And then we moved into the trade partners utilizing thermometers and filling out questionnaires, to where our current model is, where we have walk-up signs and clear indication of where to check in, what's required to check in and work on our job sites. And we utilize things like some electronic means and methods. We currently are using Job Site Check. Job Site Check is our vendor on our QR codes. And the unique thing about the temp checks that we're doing is our superintendent and our leadership on the job site, as soon as they submit those 5 questions, they get an indication if they can come in or not. If they've indicated that they're not feeling well, the system red flags them and they have to check in with their foreman, and they can't get cleared into the facility until they check in and are cleared in the system. So those are some tools. Other things we did as we're moving through the slides is looking at things like just limitations on communal areas and meeting rooms. Of course, these things we've increased some of the for meeting locations. We do a lot of remote, like we're doing now, distance. Even in the office here, when we have our operations meetings on Monday morning, Joe, our president, he'll still not meet in the boardroom. We're still meeting kind of via Teams and Zoom and that sort of thing. So moving through here, just indicating some signage. We've talked about some of these things, and as we're kind of moving through these, looking at things like hand washing stations and sanitizer stations, we have things like this throughout our job sites and offices, and then limiting access points. So this is at our main office here, but we have check-in spots, and we use temp kiosk a lot, which we found to be helpful. That's not the old paper process that you see here, but more like this, where you walk up and it can indicate they have to have their face covering on in order to get their temp read. We utilize a degree below CDC's requirements, so we're making sure that everybody's well when they come in and they fill the questions out. And as we're moving through some of these slides, I show there's our QR reader for our job site check. They ask the questions, it's held digitally. We can record that and keep record of who it was individually that was checking in. And then hand washing stations and porta johns, we increase, as we mentioned. These get serviced more frequently, and we have more available for our trade partners. Gentle reminders, as we call them, about hand washing and encouraging good hygiene on our projects that mostly everybody does. But this is a job we're doing up in Indianapolis, but for a pharmaceutical company. But we have a nice setup here during a check-in point where we have a check-in time, wristbands on the job site to indicate that they've made it through their check-in, and we have a temp kiosk inside of that little unit there that they come in. They let 2 in at the trailer at a time, and then they go out the other side. So just trying to find better ways. We're learning more as we go, and I'm sure you all have seen some of these processes be utilized on some of the projects and clients you currently work for. So
Thank you, Dan.
Yep.
Kind of talking about the business continuity plan, Nathan, what would be your suggestion when you're creating a business continuity plan, for moving forward for your employees?
Yep. So the one thing that really comes to mind is just being simple. Have a simple plan, and simplify it for everybody just so they feel comfortable. Have one person on site that is knowledgeable of what the CDC guidelines are, what your company guidelines are, that they can ask questions to. One point of contact in your office that it champions that the guidelines, make sure everybody's following those, and rolling any changes that may come across out to the field, and making sure everybody's following those. And even on the reporting side of possible exposure or positive testing, setting up appointments for your employees if they do or come into contact with someone at work, or even personally. And really, Herb touched on it a little bit earlier about having the right people on site, planning your job more effectively and efficiently. And that helps with your lead time for materials, managing the projects efficiently, managing the projects and getting them done, like Daniel had touched on earlier, quicker. You have people that are more refreshed, more focused on the task at hand. And one thing that we really try to do is just over communicate. And we found that really calmed and served to our employees that, okay, these guys do care. They want to know that they want to know that you feel and know what they're going through, from the project side, from the health and safety side, all the way through the struggles with getting the right material on site, getting the right people on site to complete the job.
Awesome. Fantastic. Thank you, Nathan. Going in, the last question that we're going to cover, how can you be better prepared for the future as it relates to a pandemic? And for the answers that we receive, better planning strategies to address pandemics. So we're going to go in and kind of talk about, one of the first things, that comes to my mind, even when I was working as a contractor in safety and loss prevention, was utilizing, professional partners, and relying upon information that we're all sharing as an industry to help each other with and protect each other. So some of those, can be your insurance agency, IEC, TEXO, AGC, STC, safety consulting. You can reach out to a lot of different professionals within the industry to gain some information and knowledge from those individuals. So going into some other additional resources, Dan, would you like to touch base on your decision matrix here? Did we lose you?
Sorry about that, guys. I was on mute. All right. Yeah, just going back to the beginning, we talked a little bit about trying to create some useful tools for our managers and field teams to make better decisions. So we created a little bit of a matrix, just gathering information, how we clean affected spaces, what we treat confirmed and suspected cases like, and following some CDC and doctors' recommendations, guidance. So this just kind of highlights the collection of that information. And we always clear cleanings and things like a return to work through myself and our HR manager here. But this slide and the next one just kind of highlights some of that decision-making processes. This thing was very fluid, right? These things were changing constantly. So we were just trying to come up with a simple strategy to help gather information, and then how the communication goes out and how we get people back to be more productive. So that's all the purpose of this was, just to kind of highlight some of those issues.
Awesome. Herb, would you like to go in? You want to hit the next slide? Herb, would you like to go in and kind of talk about some of the resources that we've put together and highlighted for the attendees?
Yeah, sure, Jeff. Thank you for passing that over. So as noted prior, reach out to your local professionals like STC, your insurance brokers, the resources that are available at your fingertips. As EHS professionals, we're used to looking and creating programs that address these types of concerns, such as a pandemic, as part of our routine practices. So if within your organization you do not have that resource or those resources available, do not hesitate to reach out to folks such as STC for assistance. Additionally, there are some free resources that you see right on the website. On the presentation itself, we have resources such as FEMA, JAMA, for those of you who are not familiar, the Journal of American Medical Association, great resource. We have HRSA, U.S. Department of Transportation, we have OSHA, we have Department of Homeland Security, Johns Hopkins Interactive Map, CDC as always. For those of you who are familiar with NIOSH, again, another wonderful resource. So again, there's an abundance of information out there from different perspectives, from logistics to personnel health to how do you help the community, not only within your organization, but how do you extend that past the employee to their families and the communities. That's resources like HRSA will assist with that. So again, there's plenty of resources, but if you folks have any questions about what's available and what some of the best practices are, I do suggest you contact your local environmental health and safety professionals such as SDC for some assistance.
Yeah, so this is just another resource. This is a contact tracing document. So as Dan said earlier, we were not putting, we want to follow HIPAA laws, right? So we would not put the employee's name, but if someone was infected or confirmed or suspected, we would do that source tracing for the next 14 days. And what we found really effective is that we'd actually have our COVID coordinator, ambassador, safety and health professional. They would call that individual every day, say, how you feeling? And you can see on the screen there that his kids started feeling sick. So this employee stayed home, went and got tested after that. So it's a really good working diary of the COVID and how it evolved. And so it does two things. One, helps you take care of the employee and get them back to work and make sure you're doing the right thing. But number two, it also helps your OSHA reportability, and you can actually prove that it was contracted at work or it was not contracted at work. So this is one other tool that we'll be happy to share. Then in closing here on the best practices, one of the close cousins to a pandemic or any kind of crisis is the overarching need that you should have a crisis management plan. And what that involves, it could be someone having a bad day at work that was injured or sent to the hospital or God forbid killed. But a crisis management team helps manage all that through the media, through how to interact with the person's family. It identifies who the spokesperson of the company is, all those intricate things on what to do if your company has a crisis. And it doesn't have to be a pandemic, but it could be anything, right? So having a crisis management team, having those roles defined, train them on the protocol for different types of situations. If you ever go to Discount Tire and you're getting your tire change or any kind of tire or any kind of service industry, on their wall, they'll have an emergency action guide. It'll be a flip chart, right? Something as simple as that could help foster a tabletop drill. Like, what do we do if there's a tornado on our job site? What do we do if there's an earthquake? Whatever it may be, right? A quick grab and go is what we're talking about there for that. Number two, site-specific plan, which we just talked about, and having that and special training and so forth. And number three, Herb talked about leveraging professional partners. So in the interest of time, I'm going to wrap that up and open it up to Q&A.
Any questions?
Yeah.
Yes.
Well, thank you, everyone. That was a great presentation full of really interesting and important information. So thank you once again for the presentation. We did receive one question in, and I'd like to encourage the audience to send in your questions now if you have any, and we'll be happy to answer them. But the question that we did receive is, was there any procedures or processes that you implemented as a result of COVID-19 that you will continue to use moving forward? And I think you addressed that to an extent, but maybe you could expand on that a little bit.
Yes. Well, thank you for the question. And, we actually had a circle discussion about that. Dan, would you like to discuss some of the things that you're going to be running with, and also Herb, if you got anything that you'd like to.
Sure. Yeah, Jeff, it's a great question. Yeah, we have this discussion quite a bit here, and some of the things are related primarily to the hygiene practices, things like hand washing stations, hand sanitizing, looking heavy at break areas, porta-john porta-johns availability and cleaning cycles, hand washing stations outside of those areas. We've even discussed utilizing things like temperature checks, even past the pandemic, even without the questions. Even we've had some discussion about that. The face covering item is something we're looking at really heavily now, considering the situation we're at in Texas. And But it's really going to be dependent on what our property manager and client wants as well. So some of these practices in some of the clients we work for, they actually highlight or outline for us some of the things that they like to see, whether it's on a reporting or a physical item out on the job site, such as hand sanitizing stations. So we're moving forward with a lot of those things because we think it makes good sense, and it's good hygiene practices for our trade partners and just makes for a cleaner, healthier work site.
Right. Yeah. And I mean, just speaking for myself, this is Jeff Wolfla. One of the things is going to be the business card aspect of it. You know, I don't think that that's going to be something that, you know, I'm going to move forward with. You know, even with my supply of business cards, it's going to go more to an electronic data transfer, right? So, you know, trying to minimize exposure for your employees from a safety meeting, JHA, business card, contract. You want to try to minimize those exposures and prevent, you know, the spread of any disease, infectious disease. So.
Yeah, and it's amazing seeing the drop in the flu, right? No matter what you believe, right? I mean, I do think cleaning and protocol and hand washing has probably helped keep people at work that might normally get the flu, right? Or whatever it might be. So I think that's a good byproduct of it as well.
Yes.
Yeah, gents, I agree with all of that. And, you know, going forward, it'll be interesting to see how those practices develop. For Osborne, I can tell you that one of the key highlights has been planning and logistics. I think this has really just forced us to reevaluate what that means for the business and our business partners. Access to the site, of how we get there, what materials are available, making sure that the right amount of personnel are there, but again, only essential personnel, I think will forever change our business. So along with some documentation management, like you folks are noting, you know, we're looking at such as conducting JHAs in the morning digitally. You know, is it sufficient enough to take a video, have personnel identify themselves instead of noting it down on paper as it's been in the past? So between logistics and kind of the IT portion, I guess, of business management going forward, I think will forever be changed due to the pandemic.
Awesome.
Well, great. Thank you very much. Great answers to that question. We have a few minutes left. Is there anything that you presented within the webinar that you'd like to take those few minutes to expand on? And again, I'd like to invite the audience to send in any additional questions that they have.
I would just, I would ask the question maybe to the panel here. As far as encouraging employees to get COVID vaccines, or is it going to be an annual vaccine or a one-time thing? How does this work? Does anybody have any, has anybody had any discussions on strategies about supporting COVID vaccinations or requiring them, or is there any noise like that going on?
No.
Okay. Yeah, I'd heard some different information from other sources, so that's I don't think anybody knows the answer, I guess, is where we're all at. So,
you know, I'll chime in on a professional comment versus you know, an Osborne employee comment. Looking at, as an industrial hygienist, I look closely at the information, and as you can imagine, it's rather confusing to the folks that are not in our industry, let alone the folks that are in our industry. One of the challenges there is asking personnel to be mandated to vaccinate, with some of the potential consequences that we're seeing, such as some of the news coming out with J&J. So I think as more data is collected, I think as a society we'll have a better understanding of what the risk is of taking the vaccine versus not taking the vaccine. But on a professional level, I have discussed this with many groups, and it's kind of a split. Some folks are very adamant about making sure that everyone gets vaccinated, while the other half is probably a little apprehensive. So for me, it'll be interesting to see maybe a year or two with a tremendous amount of metadata analysis, what the final outcome will be of all this information.
cool. Thanks, Herb. That's all I've got.
Awesome.
Well, great.
Lori, were there any other questions?
No other questions have come in, so I would like to first thank the audience for attending And secondly, and even more importantly, thank the panel for presenting this today. It was a great resource, great information shared, and we really appreciate the panel taking the time to present to IEC members today. So thank you. And with that, we'll close the webinar. I'm sorry I interrupted. Someone wanted to say something.
No, thank you. Thank you, Lori.
Sure, absolutely. So thanks to everyone and enjoy the rest of your afternoon.
Thank you.
Thank you, everyone.